Welcome to your Keep It Simple guide to penile rehabilitation. By the end of this video, you are going to know what penile rehabilitation means, why you would do it, how you would do it, and when you would start. So what do we mean by penile rehabilitation? Let's actually sidestep and look at this as a different example. Say you'd woken up after surgery and the doctor told you, as a side effect of this procedure, there are some nerves in your arm that are in a state of trauma. So this means that when you think about moving your arm and you want to move your arm, that will not correspond to your arm moving. So during this time, to keep your arm really healthy, we're going to do rehabilitation. In that experience, you would probably be thinking, right, I'm going to have some exercises that I would do regularly over time in order to keep blood flow moving in and out of my arm so that muscle tissue stays really strong and really healthy. Penile rehabilitation is exactly that. It's just for your genitals. So why would somebody be in a position to do penile rehabilitation? Well, there are some men's cancer treatments that can significantly alter erectile function after the treatment. So a typical one is prostate cancer surgery or radical prostatectomy. This is when the prostate is surgically removed. Now, there are a set of erection nerves, otherwise called the cavernous nerves, that surround the prostate, and even when a surgeon performs nerve-sparing surgery, just the light and the heat alone in the surgical procedures can send these nerves into a state of trauma. They're extremely delicate. Think of a wet piece of tissue paper that's then cobwebbed onto the prostate. So this state of trauma and the recovery from it is what's called neuropraxia. Now, neuropraxia in this case for these nerves can take up to 2 years. And interestingly, we then still see some erectile function changes from the 2-year mark onwards. But even so, 2 years is a long time for your erections not to be receiving blood flow from either arousal or, more importantly, nocturnal erectile function. So fun fact, every single person on the planet has nocturnal erections, regardless of age or gender. These aren't sexual, they're simply the body's way of moving blood into the erectile tissue and out again. Yes, women have erections. It is called the clitoris. That is full erectile tissue. It's just that, like a sexy iceberg, most of the clitoris is within the body, so you don't see it. Now, while we cannot at this point conclude exactly why the body has this nocturnal erection function, we feel it's definitely important because we can see men after prostate cancer surgery who do some form of rehabilitation, so that moving of blood into the penis and out, are far less likely to experience venous leakage, fibrosis, so this is scar tissue developing within the penile structure, which can lead to Peyronie's disease. So that would be a severe curvature of the penis, which would make intercourse almost impossible and can be extremely painful. It's also important to mention that there is evidence that penile rehabilitation can help bring back length to the penis after prostate cancer surgery. So many men that I see in my consultations report that the most devastating part of their sexual side effects was actually the shortening to their penis. In fact, I've had some men say that they now cannot urinate standing up, they have to sit down, which is a daily reminder of what they have lost. There is evidence that penile rehabilitation, especially that done on a daily basis with a vacuum device, could help to prevent further shrinkage and also bring back some length. So that's why you would do it, but how would you do it? So we're thinking through blood flow, exercise, keeping that penis muscle tissue in good condition. Therefore, I've got 5 options for you to consider, and I'm going to put some links down below on how you can learn a little bit more about each. First option is the injection. That's an intracavernosal injection, which you may hear being called Trimix or Caveject. 2 different formulas, and you may have a different experience with each. Top recommendation is that you talk to your urologist or a urology nurse practitioner who specializes in ED treatment on how you can go about being given your first injection by somebody who knows what they're doing, so they can teach you the technique and they can also monitor your results as you go, because there is a bit of a tweaking involved in getting this right for you. The results, however, can be extremely effective. I've had clients who used to say, oh, I couldn't stand the thought of needles at all. I mean, who can, honestly? But they come back and say, you know, it was so much like the erection I was used to before surgery once I got the technique and the right dosage that I'm now extremely happy with the result. Second option is the vacuum erection device. So the pros of this is that it can be used on a daily basis. So it's sort of like doing your daily push-ups. Something like this one here, the VACURECT, you can find more information on in the links below. I specialise in sexuality devices for both pleasure and rehabilitation, so I've got quite a few extra resources if this is the route that you want to take. Third option are the pills. So VIAGRA, CIALIS, these are the names that you'll probably hear talked about. They're a collection of pills called PDE5 inhibitors. And as similar to the injections, some people respond better to one than the other. Some people have side effects with one but not the other. Again, this is something I would recommend you talk to your urologist about or your urology nurse practitioner. They can prescribe these for you. Never buy anything over the internet. These need a prescription. You don't want to be putting anything into your body that you don't know where it came from. You also need to make sure through them they know your full medical history, whether this is the right option for you. One crucial side note I must make: if you're going to take Viagra or Cialis hoping that it will give you an erection after prostate surgery, keep your expectations really low. Viagra and Cialis both need working cavernous erection nerves in order to produce an erection. Without those nerves online, it's not going to do anything. So do not worry if you take one and nothing happens. There's also a growing body of literature around the idea of using Cialis or Viagra a little bit in the background every day, more like a multivitamin for your penis. So something that would protect the lining of the endothelium cells. That's a body of literature that I'm personally still learning about. It's a growing area, so talk to your urologist when it comes to Viagra or Cialis around what's going to be best for you and your program. Your fourth option is general sexual pleasure, whether that's alone, masturbation, with a partner, with or without the erection. Every time you orgasm, there's a lot of pelvic floor contraction, which again increases blood flow, and pelvic floor exercises, the ones you were taught for your incontinence, they also contribute to penile rehabilitation. So keep in mind, where does the erection begin? It begins in the mind. Your brain says there's a lot of good pleasure and arousal signals, so let's put everything in place to create an erection. Anytime you do that, you are exercising your full sexual system. While at this point in time, we don't have a body of literature, unfortunately, that looks into how masturbation and sexual pleasure can play a part in penile rehabilitation, please know there's no harm in having sexual pleasure and sex while you're doing rehab. If anything, it's common sense that it would make a really positive impact. Your fifth option. You're going to love this if you're someone who's thinking, look, penile rehab makes sense, but a lot of this sounds quite artificial. Love something that's a little bit more natural. Well, the natural cure for erectile dysfunction is cardiovascular exercise. So anything that you are doing to contribute to your heart health, that includes quitting smoking, cutting down on the booze, taking yourself for a good jog, anything like that will help your erection. It's a cardiovascular event that needs good arteries and good veins. In fact, many urologists refer to the erection as the canary in your pants because it can often be an indicator on how your heart health is performing. So for this, my top tip would be book in to see an exercise physiologist. They are trained in helping you get a program together that's going to fit you. If you have any hip ailments or anything like that, they can still make sure you're getting the exercise you need for your general health and also your erection health. So when is the best time to start penile rehabilitation? Look, funnily enough, that's one of the harder questions I find to answer, because there isn't a standard guideline or protocol on a penile rehab program that can be applied to everybody at this point. It's a field of research that's still growing. The term penile rehabilitation has only been around since 1997, and considering that this is a long-term recovery journey that people are on, we still need more literature to know, look, what are the best guidelines for everybody. What we work on are the principles discussed, and when it comes to when is the right time for you to start, 3 pieces of advice. Talk to your urologist and your urology team. They know what you've gone through in your individual journey and can make recommendations. Secondly, is to listen to your own body. If you are feeling in pain when you start any kind of rehab, it may be your body's way of telling you that it's still in a healing process. So to leave it for a bit and then come back to it. Third piece of advice is just to do something rather than leaving it and hoping something just comes back naturally. I have men who come to see me for an appointment 2 years after surgery and they haven't touched their penis at all during this time. And what they were hoping for was that the erection would just naturally return when the nerves came back online. What we can see now from the literature is that those who do something tend to have better recovery rates and also just better penis health in general than those who do nothing. So So something is better than nothing. There's also a phrase that gets bandied around, if you don't use it, you lose it. Yes, that can be a bit stressful to think about though. You know, I think a better one is just practice makes progress. This is about developing a set of rehabilitation habits that you do over the long term. So thank you so much for watching this video. I hope this has helped you. If it has, please click the like button below, subscribe to the channel, and also check out the description box. There's more links in there for you to learn more about the options we discussed today. And I'll see you in another video soon.